Endometrioza, një fjalë që për mua nuk ka pasur asnjë lloj kuptimi, por që më pas u bë pjesë e të përditshmes time. Sot do flasim pikërisht për të, një sëmundje që prek 1 në 10 gra dhe sërish është kaq pak e studiuar dhe shumë e keq diagnostikuar. Unë nuk e njihja endometriozën si diagnozë, nuk isha lexuar dhe nuk isha asnjë informacion për të, madje në librin e gjinekologjinë në fakultetin e mjekësisë kishte vetëm një paragraf për të dhe unë kaq dija. Disa vite më parë dëgjoj një video në YouTube nga një blogere e famshme, e cila po kalonte një periudhë infertiliteti dhe dyshonte se mund të kishte endometriozë. Aty kam dëgjuar unë për herë të parë për endometriozën dhe nuk e di, diçka, një lamp u ndez në trurin tim. Më kujtohet që gjithmonë kam pasur dhimbje cikli, jo ndonjë dhimbje të padurueshme, por kam patur dhimbje cikli, dhimbje gjoksi me ditë të tëra, por dhimbje të cilat unë i kisha normalizuar. Madje, edhe kur pyesja mamin tim që a është normale që kam pak dhimbje, ajo më thoshte po, është normale. Dhe si për ironi të fatit, ajo diagnostikua për vete me endometriozë në moshën 54 vjeç. Në një vizitë krejt rutinë, unë zbuloj rastësisht një kist endometriozik ose endometriom në vezoren time. Mjeku aso kohë më tha që unë kisha 2 mundësi, ose të merja një terapi hormonale dhe të kaloja në menopauzë të parakoshme, që të më ndalonte ardhja e menstruacioneve, në mënyrë që mos të rritej kisti dhe unë mos të ndjeja dhimbje, ose të ngelja shtatzan. Unë isha 27 ose 28 vjeç, sigurisht që nuk e kisha fare në plan, por thash do shkoj me opsionin e dytë. Do përpiqem të ngelem shtatzan dhe ndoshta kjo sëmundje do kaloj, do shërohet, por sa më shumë lexoja, aq më shumë kuptoja që kjo ishte këshilla më e gabuar që mund të jepje dikujt të sapo diagnostikuar me endometriozë, sepse edhe fertiliteti nuk është kaq i thjeshtë si te një pacient që nuk ka endometriozë. Një farë kohë kalova komplet në një fazë mohimi, sa më shumë lexoja për endometriozën, aq më e frikshme bëhej, aq më e panjohur bëhej. Por, pavarësisht kësaj fazës së mohimit, që zgjati goxha, vendosa që të mos dorëzohesha. Fillova të lexoja shumë, të informohesha shumë, aq sa mundem, sepse ne më shumë nuk dim për endometriozën se sa dim, por fillova të ushqehem mirë, të kujdesem për trupin tim, të kryej aktivitet fizik, të marr suplementet e duhura, por sigurisht që jo çdo ditë është e lehtë. Ndonjëherë më vjen dhe inat që e minimizoj situatën time, sepse ka ditë që mezi zgjohem, mezi qëndroj në këmbë, më dhëm gjithë trupi, kam dhimbje shumë të çuditshme, migren, dhimbjet e kokës, dhe ndërkohë jeta vazhdon. Mua më duhet të jem në punë, më duhet të jem me buzëqeshur, me pacientët, të qëndroj, të shërbej aty për ditë, të krijoj content, të bëj foto, të kthej mesazhe, të jem partnere, të jem shoqe ngushtë, të jem fëmia i dikujt. Të gjitha këto duhet i bëj kur jam në dhimbje, sepse ndryshe, nëse unë tregoj vërtet se çfarë ndjej nga brenda, njerëzit ka ditë që mendojnë se jam e ftohtë, se jam arrogante, por e vërteta është që unë thjesht mund të ndihem e raskapitur në atë moment dhe nuk kemi asgjë personale me askënd. Endometrioza është një betejë mbijetese për ditë, por ajo që realisht më ka ndihmuar shumë në këtë rrugtimin tim, fatmirësisht unë nuk hy tek ai grupi pacienteve që kanë ato dhimbjet e tmerrshme që i dërgojnë në spital, por kam dhimbje të menaxhueshme, dhe kjo për faktin se kujdesem shumë për stilin tim të jetesës, të paktën të ushqyerit mirë dhe marrjen e suplementeve. Kam pasur fatin që të gjej dhe mjekun e duhur në këtë rrugtimin tim dhe jam shumë e nderuar që ta kem sot të ftuar në podcastin tim, në këtë podcast përmbyllës dhe episod të fundit të Beyond ONIA me Antën. Do të kem të ftuar mjekun tim të endometriozës, Dr. Kostantinos Kyriakopoulos. Dr. Kostantinoa ka një qendër endometrioze të cilën e ka ngritur në Athinë me një ekip të specializuar mjekësh të specialiteteve të ndryshme që kujdesen për të gjitha ne që vuajmë nga endometrioza. Jam krenare që e kam atë sot këtu për të ndarë të gjitha dijet e veta dhe eksperiencën në menaxhimin dhe trajtimin e një sëmundjeje kaq të panjohur siç është endometrioza. Hello, Dr. Kostantinos. It's an honor for me to have you in my podcast. I'm very pleased that you can share all your knowledge with us today. And what I really love about your work is the passion you have for it and the passion to help all the women that suffer from endometriosis. So thank you again for being with us here today.
Thank you, Ada, for your very warm welcome. It's a great pleasure to be here and be part of your podcast that you do. Which I find really interesting. And what is very strange for me is that you also deal with other conditions. I think your patients are very lucky to have you because for sure you have a very wide range of knowledge. So it is my honor to be here.
Dr. Kostantinos, can we start from the basics? What is endometriosis and how would you explain endometriosis to someone that is just hearing about it for the first time?
This is a $1 million question.
Yes.
Yes. The truth is that what we know about endometriosis is much less what we don't know. If we should describe endometriosis with a couple of words, I think that we would say that first of all it's a complex disease and it is a systematic inflammation. So it's not only endometrium-like tissue that grows in areas outside of the uterus, something much bigger than that. It has many components. One of these is inflammation, the other one is immune dysregulation or a nervous system hormonal imbalance. There are many things that come into this disease. One of the reasons that it's so misunderstood, in my opinion, is that medicine has tried to fit conditions like endometriosis in a much smaller box than it actually seems. So endometriosis is much bigger than what we think.
Many people associate it only with painful periods, and I think that's the main reason that's why endometriosis for so many years have been just inside that box you just described. We know that endometriosis affects also other parts of our body. How can it affect other organs rather than our uterus, our ovaries?
Endometriosis is an inflammation. It has many forms. It is a whole body disease. It can grow virtually anywhere. We have seen endometriosis on the lung. There are patients that, for example, spit blood during their menstruation. There are other women that they have blood in their stools. This means that endometriosis may have grown and infiltrated with the bowel, and etc. Endometriosis can grow anywhere. So it's not a purely gynecological condition, and this is another reason, for example, that this condition is misunderstood. It's not a purely gynecological condition. It can affect many systems. Many specialists may have to get involved in treating this disease.
Yes.
Endometriosis also doesn't always show in imaging. So there are many examples. For example, patients have gone for an MRI, ultrasound, and all of them were clear, were negative. But in the end, as it was proven, there was disease inside.
Why the diagnosis of these patients is so delayed? Because I have seen also in myself, I have been asymptomatic for a lot of years, and then just I found my endometrioma on a routine, on an ecography. But there are other women who suffer a lot during their menstruation, with a lot, they are in pain. Why the diagnosis of this disease is so delayed? Because statistically it takes 7 up to 9 years to be diagnosed or to be taken seriously, maybe?
I think other than this, first of all, knowledge about endometriosis, I think now was very little. Another thing is it's a cultural thing. For example, if I am a woman and I am in the high school and I complain about pain during periods, everyone will tell me, okay, you're a woman, some women are unlucky, they have more pain during the period. No one died because of that. You can take a simple pain and continue your life. And even mothers of these patients that had also endometriosis will tell their daughters, because they don't know about endometriosis. I have pain during my period too. Nothing bad happened to me. Then these patients may go to their doctors. Okay, they will go to 10 different doctors. They complain of pain during period. They will be examined. And of course, if all exams come back negative, physicians will tell these patients you don't have endometriosis. So there are some cases, there are extreme cases, of course, but I have seen them. These patients, for example, they go to a psychologist because they believe that something is wrong in their head.
Yes.
It can't be that 10 different doctors don't find anything and they take up pain. Something may be wrong with them. Okay. So it's a cultural thing also. In ancient Greek, the uterus is called hystera. But also there is another word like hysteric. The person that screams, etc. So there were women with endometriosis in ancient Greece, for example. They were crying. They were staying from patient, and they were saying, the people were saying, okay, look at that hysteric. They want to have a uterus. It's also a taboo to talk about to her friends that she has much pain. So she suffers in silence. But it's a good thing lately that, there are many advocates, there are many groups on the social media that promote and raise endometriosis awareness. And of course, you're doing this today, and you've been doing this for a long time.
But what are the main symptoms that a patient should concern or should make them to go to ask for proper help at their doctor? What are the main symptoms of endometriosis? What are the main symptoms? What is not normal, let's say, that can take us to the doctor?
Endometriosis can cause many symptoms. We could discuss about this the whole day. The most common is dysmenorrhea. This means pain during menstruation. So the normal would be to have some period, to have some pain. Okay, we take 1 or 2 simple painkillers and we continue our normal life. But if there is a variation to that, if we take a couple of painkillers but we are in bed, we have pain, we use heat baths, we vomit, we cannot go to work, we cannot go for coffee, to the gym, this means that something is wrong. Another symptom that is also underestimated is weakness, low energy. So women with endometriosis, due to a slight increase in their metabolic activity, they consume much more energy than another lady that doesn't have endometriosis. So they have low energy, they feel tired in the long run. And also if, for example, they have pain during menstruation and they cannot get enough sleep at night, they feel much more tired. Headache during period. Conclusion is that if someone feels that a symptom is not right, then she should investigate, no matter what doctors say or friends say.
Let's divide it like that. It's not correct, but does a normal gynecologist know how to differentiate endometriosis? Should he diagnose it from the start? Or what are the signs that we can see? Because an echography is not enough. If you don't have an endometrioma, there are no signs, right? They can tell you that you are normal. Do we need, you are completely healthy?
There are many specialties, as you know, around medicine. Every gynecologist or every physician or every GP should have a low threshold for referring patients that he or she believes that they have endometriosis to an endometriosis center or to an endometriosis specialist. So I'm a gynecologist. Okay, I have no clue about gynecological oncology. If I think that, for example, I see a cyst that it has some suspicious characteristics of being cancer, it's not right for me to treat that or try to treat that. I have to refer it to someone who has more knowledge in order to diagnose this cyst. Every physician has a very has known that, for example, that endometriosis is a fact, is a reality, it's here, and it can be present even though all exams are negative. I think this is enough for a good start.
But can a trained radiologist identify endometriosis during a transvaginal ultrasound or an MRI?
Endometriosis have many forms. Some of them are advanced, they are nodules, they have affected organs, there are big lumps, the nodules, and there are other types of disease that are called subtle or superficial endometriosis, which are difficult to be discovered during any radiologic examination. So even if all exams come back negative, this doesn't mean that we don't have endometriosis. It means that we don't have advanced endometriosis. So we can find only advanced disease. Of course, the more experienced and skilled and knowledgeable radiologist or gynecologist is, then he or she can find more than another physician who doesn't have knowledge about endometriosis.
What are the imaging signs we should look for in deep infiltrating endometriosis? For example, not only in the imaging we see from the ultrasound or MRI, because you are not a radiologist, but what are some of the signs that the patient might feel in deep infiltrative endometriosis? Are there always signs, or it can be silent and it still might be deep infiltrating?
It's a combination. Everything that the diagnosis is a combination of medical history. There are some specific questions we share with our patients. In our center, we use vaginal ultrasound a lot and vaginal examination. So we get all the information that we need from these exams. But of course, MRI has a very important role to play. Now, there are many signs. It depends on where the disease is located. Is it an endometriosis? Then yes, we can see that easily. Okay, if that's what I ultrasound. If the uterosacral ligaments are infiltrating, if the lesions are big, we can see that in transvaginal ultrasound too. If we have infiltration in the bowel, we can see that with transvaginal ultrasound. Some gynecologists specialized in transvaginal ultrasonography were very experienced, and they provide a very accurate image of what is going on inside the abdomen.
But still, laparoscopy is the gold standard of diagnostication of endometriosis, right?
Not always, it depends. So let's say that we have a patient that has silent endometriosis, she doesn't have anything. And let's say that this patient with silent endometriosis has some subtle lesions that we cannot discover with any radiologic exam. So from medical history, we cannot get the suspicion whether this patient has endometriosis or not. And during our examination, we cannot locate disease. So yes, for her, the only way that we can diagnose endometriosis is only if we have an eye inside her abdomen and see what's going on.
I know that you only perform laparoscopy, excision surgery, and you don't prefer ablation, right?
Correct.
There is a lot of confusion and there are a lot of questions regarding this topic, because there are still a lot of doctors who perform surgery for endometriosis and they only do ablation. There are some disadvantages from ablation. Can you explain that to us, please?
What is ablation? Ablation, or in other words, electrocoagulation or burning, is the same thing, no matter if it's done with bipolar instrument. This is an instrument like transmits heat, or laser, or whatever. So this is burning the lesion. But most of the time, the lesions are deep. They go below the peritoneum. The peritoneum is the membrane that covers all the internal organs. So with ablation, we burn the top of the lesion. But the rest of the lesion, that is deeper inside, stays intact. So it will then regenerate, and that's why ablation has high chances of recurrence. And sometimes symptoms come back more intense than before the surgery, because during ablation we add heat there.
Yes.
We
Increase
contribute to the whole inflammation, correct? And symptoms are worse. The gold standard for treating endometriosis today is excision surgery. This means that we follow the lesion and we examine the lesion as a whole. Long-term pain relief is much better with excision.
I wanted to ask. You talked about recurrence of the disease, but the quality of the life of the patients after the excision surgery is much better. So even though there is a slight chance for the disease to come back again, maybe it will not come back as awful as it was before. So this is a chance that patients with endometriosis have to take, because it's the best solution, surgery, for them.
The surgery is always the last resort.
Yes.
It's not like going for coffee.
Of course.
There's many complications.
Yes.
So if we don't have any light in the tunnel, yes, we go for surgery. There is a minority of patients that doesn't benefit from excision surgery. This means that these patients may keep having the same symptoms after the surgery like before the surgery. In some cases also, excision surgery, especially if it is aggressive the first time, it can be curative too. So we don't see endometriosis coming back.
But do you take out all the endometriotic lesions that you see everywhere in the peritoneum? So you take everything out?
Yeah, we take everything out, no matter where it is located.
Okay, so even though you may have located just an endometrioma, you see during surgery you find something on the balls, something on the ureters, you take them also out?
Correct, in the diaphragm, the whole abdomen. So, but before the surgery, we have all endometriosis surgery. We have a very detailed discussion with the patient to cover all the extreme case scenarios that we may find during the operation. Because endometriosis is very unpredictable. We may find endometriosis in areas that we didn't expect. Of course, we cannot go there and do whatever we want. We have to get the green light from the patient.
Yes.
We cannot wake up the patient during the surgery and tell them covering all the areas prior to the surgery is extremely important in our discussion with the patient.
I remember something from our first consultation that we have had together, and you told me if I get pregnant and I have a daughter, I should be worried from her first menses. If she has the slightest pain during her menstruation, I should we should go together and see a gynecologist, because she might also have endometriosis like me. Do you see endometriosis in little girls also during from their first menstruations?
Endometriosis is a hereditary disease. It has a gene component. So we usually see female members in a family, all of them having endometriosis. So when someone has endometriosis, when a lady has endometriosis and she delivers a girl, she must have her eyes open and be on alert, because if her daughter, for example, starts missing school during period or complains about pain during period, she shouldn't dismiss her, no matter what physicians say or what friends say. She must take it very, very seriously.
You explained before that laparoscopic surgery is the last resort for the patients. What are the first steps that or some advices?
In our center, we try to avoid such medication. Probably refer to generate analogs or like alvocampilopron or NISA. We try to avoid them as much as possible because they have many long-term severe side effects. We try painkillers. We try, for example, the contraceptive pill, the progesterone on the pill, the myelina coil, but we try to avoid generate analogs. Some patients also benefit from change in their diet. They have decreased gastrointestinal symptoms. We don't know how this how it works exactly, but we don't care about that. As long as the patient finds feels good, and we avoid surgery, because this is the goal. The goal is not to go for surgery, the goal is to avoid surgery. We're happy and we don't care how it works. But from medical aspect, yes, we try painkillers and hormonal medication, but we try to avoid generational loss.
You also have explained to me that on our first consultation, I remember a lot from 3 years ago, that you don't prefer the hormonal therapy because endometriosis lesions produce hormones of themselves. So they don't respond well to the hormones we take orally. You explained back then that that's one of the main reasons you don't prefer a hormonal therapy, because endometriosis lesions just do as they want, even though we try to suppress them.
Treating endometriosis with medication sometimes can be very tricky. So from my experience, it's not like from my experience, I see that hormonal treatment, if we call it treatment, it's not a treatment because we don't treat the disease, we treat the symptom. Works better most times when the disease is isolated, it's not spread out the body. The symptoms are cyclical, and we don't have established chronic pelvic pain, this brain sensitization. There are many different types of endometriosis lesions. Some of them may treat them with they may respond to contraceptive pill, for example, or the mini pill. But there are other types that they don't respond. So it's a matter of trying different regimens in each patient in order to maybe find something that that fits here. It's not that one rule fits.
You told us in the beginning that endometriosis has also a neurological aspect, immunological aspect, and I think that it's a breakthrough now in the endometriosis field that it is spoken about the neuro-immunological aspect of the disease. Can you explain that in simple terms, and how does the immune system and chronic inflammation contributes to the severity of the condition?
Yeah, so we have three components here. We have inflammation, we have the immunological system, the immune system, and we also have the nervous system. So in endometriosis, in some cases, these three components they are interacting in a way that their collaboration amplifies symptoms instead of shutting them down. So they increase symptoms. For example, inflammation. Inflammation is a process that is meant, it's a short-term repair response. Make a small conclusion of all this because I don't want to get into much medical jargon. We have inflammation activates immune cells. This irritates the nerves. The nerves release signals that increase inflammation, and then back again, we're repeating the cycle. So it's a vicious cycle.
Not a lot of research and definitive solution to the disease.
Yeah, correct. But there are many people out there that they're sacrificing much of their free time daily to try to find answers, to give answers to the patients, and all the credit goes to them.
Of course. I wanted also to discuss some things regarding endometriosis and fertility issues. I know that you are not a fertility specialist, but you, of course, you have knowledge, so you can share some of it. How does endometriosis affect fertility, And how should someone think about family planning when they are first diagnosed with endometriosis? Should we think ahead, plan ahead? What can we do? Or does it affect fertility or not?
So this is a very good question. First of all, patients who have endometriosis shouldn't be terrified or frightened that they never have children. No, that's not the case. Now, there is a small minority that struggles to stay pregnant. So they try for 1, 2, or 3 years and they don't manage to get a positive pregnancy test. So endometriosis can interfere, in terms of fertility, in many ways. For example, there are mechanical ways, there are inflammatory ways, there are hormonal ways, there are neurological ways. Okay, so we may have a patient that gets filled with dust. We may have adhesions. The inflammation, for example, may lower the quality of eggs. They may even lower the quality of the sperm. They may interfere with fertilization. And also, of course, there are hormonal changes like progesterone resistance or altered estrogen signaling, and also they may interfere with embryo implantation. So it's in these patients, for example, the immune system doesn't switch into what we call a pregnancy-friendly mode. Take-home message is that we shouldn't be afraid. Okay.
Yes, give some positivity.
Yes, of course, we should we acknowledge that I can do it. We talk with our gynecologist, with our IVF specialist. We are proactive. If, for example, AMH is very low, we take care possibly to freeze some eggs. Okay, we monitor our situation by condition closely, and everything can go right.
Do you think surgery helps this kind of patients? Because you reject to do a surgery on me. But do you think surgery helps patients who suffer from infertility?
Decision for surgery or not should be personalized in every case. If, for example, we have a patient that has been trying for many years for pregnancy, she has tried multiple IVF protocols, etc., and she cannot stay pregnant, then yes, this patient is a candidate for surgery. Let's say that we have a patient that has not tried for pregnancy. For this patient, we shouldn't go. In our practice, we don't go for surgery because we don't know beforehand whether endometriosis in her case would be a problem, would be a hindrance in staying pregnant.
What advice would you give to someone who is listening to us today? What is a take-home message for them who suffer from endometriosis, who suspect endometriosis? What would you tell to them?
I would say that if you suspect that you have endometriosis, you should investigate it further. The majority of patients that come to our center, they have diagnosed themselves. It's very awkward, but positively awkward, is that I have seen that the instinct of a woman is very accurate. So we may have a very good instinct. When they think that something is wrong, then most of the times they're right. So if we have pain that disrupts our life, okay, we have to investigate it. And of course, we don't have to wait until we're bad enough so that we can go to the doctor. So pain is very subjective. Okay, we don't rely on tests. Okay, even if tests are normal, we may have endometriosis. And if something is wrong in your body, we have to take it seriously, no matter if all other people take it seriously or not.
You have been very thorough, Dr. Kostantinos. I appreciate it a lot for what you did today on my podcast, sharing your knowledge. You are very empathetic with your patients, and I have a lot of my patients that have done a consultation with you, and they say all the same thing, that you explain to them a lot and you take time to explain everything in details and to be thorough on everything, and you are much appreciated in this field and for all the work you are doing for endometriosis. It was again an honor for me to have you here today.
It was my honor being here, because the questions that you asked, Ada, are exactly to the point. Okay, and you don't expect someone from a different specialty to ask these questions. You may expect from an endometriosis patient to ask these questions, because I suppose you have studied a lot, and probably you know much more than I do about endometriosis, since you ask. I'm certain about that.
It's just experience from the disease. I'm trying also to do my best to live a healthy life, to reduce the stress, but it's not always easy because I'm a doctor. I have to spend a lot of time in my clinic with the patients and everything. It's a stressful job. So that's what we chose to do in life.
It's more stressful. Yeah, it's more stressful if you are as amazing as you are as a doctor. So all the credit goes to you, Ada.
Thank you.
Thank you for having me here.
Thank you very much, and have a nice day, and thank you very much.
You too.
Goodbye. Edhe kështu i erdhi fundi këtij rrugtimi ton prej 12 episodesh në Beyond ONIA me Antën. Jam e lumtur që e përmbylla këtë podcast për një bisedë me një mjek specialist mbi endometriozën, sepse kemi nevojë të dëgjojmë mjek të specializuar për këtë lloj sëmundjeje. Ky podcast ka qenë si një lloj terapie për mua, sepse kam thënë me zë të lartë të gjitha mendimet e mia, qoftë në lidhje me mjekësinë estetike, por edhe në lidhje me patologjisë si PCOS-ja dhe endometrioza. Uroj shumë që i gjithë informacioni që kemi shpërndarë në këtë podcast t'ju ketë fuqizuar, t'ju ketë dhënë më shumë dije për të marrë vendime të duhura, qoftë për të zgjedhur trajtime të duhura dhe mjekun e duhur në procedura të mjekësisë estetike, por gjithashtu të ketë qenë një udhërëfyes dhe një gujde mirë për t'ju ndihmuar në rrugtimin tuaj me PCOS-ën dhe endometriozën. Jam e lumtur që e realizova, ka qenë realisht shumë sfilitëse dhe shumë impenjative për mua, sepse ju nuk e dini, i keni parë vetëm këto episodet e bukura, por kanë qenë të xhiruara nga 4 episode në një ditë dhe ka qenë realisht shumë e lodhshme, por podcasti u pëlqye, ju e keni përqafuar, e keni dëgjuar dhe nuk mund të jem më e lumtur se kaq. E kam bërë vetëm nga pasioni dhe doja të dilte diçka shumë e mirë. Faleminderit që na keni ndjekur çdo të mërkur, faleminderit që më besoni mua, faleminderit që vini te klinika ONIA dhe kaq. Ju uroj gjithë të mirat. Ndoshta do të shihemi në një sezon të dytë, nuk e di çfarë ka rezervuar fati, por për momentin shijoni të gjitha këto episode që kanë dalë deri tani. Faleminderit nga zemra. Mirupafshim.